Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in this interesting series which I am conducting as a sharing of the knowledge and experience. As you know, I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. For paid online consultation, I have the very expert team of the doctors, Ayurvedic physicians, Ayurvedic children specialists, Ayurvedic gynecological specialist, gynecologist, Ayurvedic gynecologist. So all these people are working with me. So anybody, any health problem, you just WhatsApp me for paid consultation 9226810630. The number is also given in the description. Today's topic in the series of Ayurveda is in general medical practice or Ayurveda in GP. Actually, you may be having a big question mark in front of you. Sir, why you are discussing the disease which is nearly eradicated from the India? We are just carrying on the preventive measure, prophylaxis measure with the proper vaccination. I know, my dear friends, that if you ask, does polio still exist in India, on the Google, you will find this answer. On 13 February 2023, India has completed 12 polio-free years. A remarkable achievement has been made as a result of consistent, determined efforts and genuine commitment at all the levels, social level and governmental level. My dear friends, although I know this, but let me clear you that polio or polio similar type of paralytic problems occurs in the children or in adult, then you can use this type of the management, similar type of management in any cases of paralysis or hemiplegia or weakness of the upper or lower extremities. According to Ayurveda, this is Vata Vyadhi. Try to understand. Vata, Pitta, Kapha are the bioenergies. Vata bioenergy is responsible for all types of movements. Pitta is for digestion or metabolism, and Kapha is for nutrition, stability, and growth. So, Vata disease is this, which is related with the musculoskeletal disorders, are also included in the Vata diseases, but neurological problems are also included in Vata diseases. My dear friends, so you must understand, if we want to prevent this particular type of the paralysis problems, then not only polio, but such type of the problem. That's why I have discussed this particular topic. You must try to avoid Vata, Prakopak, Ahar, and Vihar, the food stuff which will increase the Vata dosha. For example, Vata dosha or Vata bioenergy has the properties Tatra Ruksho Laghu Shitaha Khara Sukshmaschalo Anilaha. Anila is a Vata dosh. A Nala is Agni. A Nila is a Vata dosh. Tatra Ruksho, always and every time you are eating a dry food stuff without consuming adequate amount of water or included some liquid substances like Indian curries, buttermilk, fruit juices, and absolutely dry, no milk, no your rice and wheat and chapati and all these things, but only sandwiches and dry substances. Lot of fasting if you are doing, then that is bad for the Vata dosha. If you are keeping late at night, that also provokes the Vata dosha. Irregular lifestyle, hectic lifestyle, mental stress, mental depression, all these factors contribute to the Vata dosha prakop. So we have to avoid that. Anyway, in the polio, you know that there may be some fever in the beginning, then there is a pre-paralytic stage, and then paralytic stage, and then the residual stage. The main problem is in the motor system because virus is affecting that particular spinal cord, and then you get loss of movement of the extremities, either upper or the lower extremity. But basically, it is polio is restricted with the either of the leg, right leg or the left leg. This is the affection of the viral infection, and it may be coming through the contaminated food or even the droplet infection. So let us talk about the outdated or eradicated polio problem, but not as a polio, but considering the Vata diseases. Etiology, the majority for the polio as such is under 5 years. Can you see over here? rare before the age of 6 months. During the endemics, older children and adults can also get affected. Whenever there is an endemic, then it is a risky condition. Males slightly more affected than the females, gender-wise distribution, more common in the summer season or in the autumn season. Known contributory factors include the pregnancy, tonsillectomy, then excessive exertion and fatigue. Recent immunization may be followed by provocation of poliomyelitis at the injected limb. Now, mode of transmission, the virus, that is poliovirus, is spread by droplet infection like that, and fecal contamination in the acute phase of viremia. From the blood, it passes to the central nervous system. This method of spread within the body takes the 4 stages of the disease. At any one, it can be stopped or it can be arrested. Silent infection, virus is in the elementary phase. Abortive poliomyelitis, virus in both elementary as well as the viremic phase, and non-paralytic polio, virus in elementary, viremic, and neural phase. Then paralytic poliomyelitis, virus in all the 3-4 phases, its action on the neuron causing the paralysis. Now, what type of investigations are expected in the poliomyelitis disease or polio? Cerebrospinal fluid, you know that brain, it has a liquid or the fluid, it's a floating part, mastic or the brain. Increased white blood cell, that is indicating some infection. High polymorph, that is a neutrophil count is more in the first few days, followed by predominance of lymphocytes, suggesting the chronic infection. Sugar is absolutely normal. Throat swab can be taken. Virus usually detected in a variety of tissue cultures in within 1 to 5 days. Stools virus can be identified. And what treatment you can give, especially peculiarly for the polio, of course, it is not there now. Vaccination as per the schedule for the children is a must. If possible, try to avoid injectables for children, especially in the rainy season, no injection. From the month of June, July, August, when I was actively practicing offline, now I am practicing online only. But whenever I was practicing offline, I never gave the injection in this June, July, August, September month because of the fear of the getting affected with polio virus. For diagnosed patient as poliomyelitis, first few days of indoor treatment is advisable. For 6 weeks after confirmed diagnosis, avoid the injections and the massage. Fomentation by warm wet cloth may be done to avoid the contractures of the joint, help the patient for the systemic movement. Physiotherapy, very essential, physiotherapy. Then splint or sandbags tied properly can provide necessary rest for the muscles and ligaments. After 6 weeks of rest, train patient in systematic movements of the joint. Some physiotherapist will visit the house and he will train the patient how to do the exercise of the legs, hands, and the joints. So this is the most effects can be obtained within the first 6 months only. So be hurry. Following supportive treatment can be given for any vata problem having paralysis condition. Nevertheless, that means it's not necessary only and only in the polio. Mahayogaraj Gugulu, that is used in the Dhatu Kshayajanya Vata Prakop. Remember this, Mahayogaraj. But Mahayogaraj is a joint. Yogaraj plus nutritive metals are there. So it can be used in Amavastha as well as the Niramavastha. Chavanprash is the best rasayan, 2 teaspoons 2 times in a day. Then Shatapaki Bala Tail, Arya Vaidya Shala, Pottakal, 2 drops 2 times in a day with warm water internally. This is internal. Gentle systemic massage with Chandan Bala Lakshadi Tail, followed by Svedana, because Snehana and Svedana, oiling and fermentation are the best policies for any vata diseases, that is musculoskeletal or neurological problems. Encourage the patient for the Basti treatment under the specialist of Ayurveda doctor. So my dear friend, this was the discussion regarding the polio, but you should not restrict all these things to the polio. Any type of the hemiplegia, paralysis, or the muscle weakness patient can be understood in this particular line of thought process. Okay, so thank you very much. I request all of you to subscribe my YouTube channel and press the bell button icon to get the notification. Thank you very much and have a nice day. God bless you.